Hi, my name is McKenna Koima, and I was in a group with Abby Vetch and Karina Timmermans, and today I'm going to be talking about keratitis. So what is keratitis? Keratitis is an inflammatory condition that affects the cornea of your eye. And so the cornea is the clear part of your eye that covers both the iris and the pupil. So keratitis is a very common condition, and it's usually caused by either an infection or an injury to your eye. So some symptoms that you may be experiencing if you have keratitis could be things such as eye redness or pain, extra amounts of tear or discharge coming from your eye, having a harder time opening your eye because of pain, having blurry or decreased vision, and then having a sensitivity to light or feeling like there's something in your eye. To assess this, the doctor will probably just look at your eye using a pen light, and this will just help him check your pupil's reaction and just look for irregularities of your cornea. So we're going to look at some causes as to why you could be experiencing these symptoms. One of the potential reasons could be that you had an injury to your cornea, and this could just be from an object scratching or even injuring the surface of your cornea. And this injury may be allowing microorganisms to gain access to your damaged cornea, which could be causing an infectious keratitis. Another possible cause could be from contaminated contact lenses. We believe that this could be a cause in your case since you did let us know that you do wear contacts. And so this just means that bacteria, fungus, or a parasite were maybe on the surface of your contact lenses. And so when you put your contaminated contact lens into your eye, it caused your cornea to become infected. And this would lead to infectious keratitis. Also, if you wear your contacts for excessive amounts of time or overwear them, this could cause keratitis to develop as well. Some other causes could include the virus like herpes and even the bacteria that causes gonorrhea. However, we don't believe this is relevant in your particular situation. Contaminated water is also a cause, so if you've been swimming in a hot tub, ocean, river, or a pool recently, then the bacteria could have entered your eyes. And so if you were exposed to this bacteria, this could be causing your cornea to become infected. To diagnose keratitis, we may first start by doing an eye exam. And during this exam, it may be uncomfortable to open your eyes, but it's really important that the doctor can look at your eyes and just see how well that you can see. A pen light exam may also be done, and this is just when the doctor will look at your eyes using a pen light, and this will just help him check your pupil's reaction, size, and other factors. He may also apply a stain to the surface of your eye to help identify how bad your keratitis is and any irregularities of your cornea once again. A slit lamp exam is another exam that may be done, and this is just when the doctor will look at your eyes with a special instrument called a slit lamp, and this just provides a bright source of light and magnifies your eyes so the doctor can look at it better, and also just see if the keratitis is affecting any other structures of your eye. Lastly, we will do a laboratory analysis, and this is just when the doctor will take a sample of your tears or some cells from your cornea and look over it at the lab. And this is just to determine the cause of your keratitis and to help develop a treatment plan for your condition. So overall, we will just have to examine your eye very thoroughly to determine the next steps that we have to take. So treatment definitely depends on what type of keratitis you have, and so if we find that you've developed non-infectious keratitis, treatment options would include artificial teardrops or a 24-hour eye patch, or even some topical eye medication, depending on how severe this is. However, if we find that you have infectious keratitis, the treatment options will vary depending on what caused your infection. So if we find that you have bacterial keratitis, then the treatment would include antibacterial eye drops to treat the infection. However, if the infection is moderate to severe, you may need to take oral antibiotics to get rid of the infection. If we find that you have fungal keratitis, we would treat you with an antifungal eye drop and oral antifungal medication. If you have viral keratitis, antiviral eye drops would be used, and oral antiviral medications may be effective as well. However, some viruses need only supportive care, such as some artificial teardrops. So as you can see, most of the treatment includes some sort of eye drop or medication. However, if we find that you have keratitis that has been caused by a tiny parasite, this would be more difficult to treat. So antibiotics could be used. However, some infections are resistant to this medication. So in severe cases of this, we may require a cornea transplant. I don't think we need to worry about this in terms of your condition. However, I just thought I'd let you know the reasons that it could be caused by. So more than likely, we believe that you have infectious bacterial keratitis from your contact lenses, so the doctor will probably prescribe you with some eye drops and medication to treat this. Since we believe that you may have contracted this from your contact lenses, we want to help you be aware of how you can prevent this in your future. So wearing contact lenses, especially sleeping in them, increases your risk of both infectious and non-infectious keratitis. The risk typically stems from you wearing them longer than recommended, such as sleeping, not disinfecting them properly, and wearing them when you're swimming. So since you do wear them, the doctor may just simply follow up with you about how you're caring for your contacts such as using them properly, cleaning and disinfecting them right so that you can reduce the risk of developing keratitis again. So simply stated, just wash your hands before you touch your contacts and never wear them at night. The prognosis for most cases of keratitis is very favorable, and although it can get worse with time and potentially lead to blindness, we caught it early enough to treat it, and this will allow you to heal without a loss of vision, which is a very good sign. So that's all I have for you today. If you have any questions, feel free to ask. Otherwise, this is the source that I use to get my information, and you can feel free to check that out as well.